Hello, welcome to our Behind the Investment live series. I'm really excited. Apologies, we're a touch late. We're 11 minutes after when we said we were going to start. The joys of live is that there were a couple technical issues, but I'm really excited to introduce our two guests for today. Hilary Gosha is the Managing Director at Insight and runs our on-site operations team. So excited to dive into how we're going to partner with Clarify Health, our newest investment. And also Jean Drouin, who is the CEO of Clarify Health. So Jean, Hilary, thank you so much for joining me live today.
Great. Nice to be here.
Thank you, Nikki.
Perfect. And for everyone who is listening in and watching us live, the other joy of it being live is please feel free to pop questions that you have into the chat, and we'll make sure that we get to them as we go. But first things first, I wanted to kick off with something a little bit fun. Something that a lot of people don't realize is, during the process that portfolio companies or prospect companies are getting to know Insight and we're getting to know them, is you learn a ton about each other. So we're going to open up with a fire round because you've spent considerable amount of time getting to know each other. So I'm going to ask each of you to tell me the other's elevator pitch. Hilary, tell our audience who Clarify Health is, and Jean, who is Insight in your opinion? So who wants to start?
Jean, you go first.
Thank you, Hilary. Insight is now on to its 10th or 11th fund, I believe, and they have built an amazing reputation scaling software companies across a host of industries. One of the things that is especially attractive about Insight is that they don't just come with money and pattern recognition from prior experiences. Hilary actually runs their on-site team, where they have built a 60+ strong team of former operators and folks that are matched against each of the important functions in our company to help turbocharge our growth. So for us, the combination of the track record, the clear ability to help us to accelerate, and then critically, and maybe the most important thing, was the cultural and mission-driven fit between the two teams. So hugely impressive for us that Insight really means it when they say that they have a commitment to diversity and that they have a commitment to doing good, through the businesses that you grow.
I love that. I'm going to dive into that later. Hilary, that's a tough act to follow, but over to you.
Yeah, Jean, I hope I do you justice. Let's see. Jean and his co-founder, Todd, it is a mission-driven business, which is, again, why we were excited to partner with them. But really to enable healthcare organizations to deliver better care, better therapies through turning previously unusable siloed data into insights and intelligence that helps healthcare decision makers make better decisions for patients and lead to better outcomes. And so, if I have to really summarize it, it's the sophisticated AI-driven business intelligence platform, very user-friendly. It allows payers, providers, and life sciences organizations to make better decisions so they can improve the quality of healthcare. Did I do it?
How did she do?
Very well. Very, very well.
Perfect. Well, Jean, before you actually started Clarify Health, you spent a large portion of your career at McKinsey in their health practice. And, the ecosystem, the industry has evolved demonstrably, and especially over the last 12, 18 months as we've been dealing with COVID. But what was it during your time at McKinsey that you saw or experienced that gave you the idea to start Clarify?
Sure. So a couple of things. One is, if you talk to macroeconomists who specialize in healthcare, they'll tell you that whether it's the US, Canada, the UK, Australia, Singapore, so the well-to-do OECD countries, about 20% of what's spent on health doesn't produce much of an outcome. So, in the US, that's almost $1 trillion a year. And some of it is because the wrong diagnosis is made up front, but the majority of it is because in every individual patient journey, there are decisions that need to be made. Do you do this test? Do you match up with this physician versus another, et cetera? And it's the sum total of all those little decisions that ultimately add up to what is spent and the outcomes that are delivered. And in working with clinicians, it became very clear that it wasn't that they were averse to getting good information that benchmarked them and would help them to do better, but they felt really hard done by the prior methods that we had. Because, if you think about it, if the cardiac surgeon that deals with all the most complex patients that nobody else wants to see, that cardiac surgeon will have a higher mortality. If you just compare mortality, they're not going to look great. And they'll start reacting very negatively to the insights that they're getting. And so coming at it from that, I said, well, okay, where is it that they've solved this problem? And interestingly, in sports, they have very sophisticated analytics to look at the difficulty of the opposition faced by players. And so by replicating sports analytics, so Moneyball to healthcare, on a massive data set, you can now meet clinicians emotionally where they want to be met, which is, okay, it's okay that something's going to measure me. I want it to feel fair and to recognize the difficulty in my patient. So that was one piece of it. The other piece is that pretty much any major business question in healthcare, is this a good doctor? Should I hire this hospital or doctor? Is this a set of patients that would benefit from my drug? All of those insights live in individual patient journeys that you would like to have a history of over time. And so there's a concept of having a journey ledger, and from that ledger of stacked journeys, be able to answer pretty much any business question in healthcare. So it's the combination of those two things, helping clinicians emotionally to accept the data and trust it, and being able to render it on all of these patient journeys in a much richer way.
That's fascinating. I love the Moneyball reference. And for all of we have a lot of sports fans at Insight and sports analogies all the time. But you've clearly highlighted, as many of us who are listening into this behind the investment of our most recent investment in Clarify Health, healthcare is such an emotionally charged sector for both patients, but as you've clearly articulated, for the healthcare practitioners and doctors as well. And Hilary, I know that you have a focus and an interest in healthcare, but what a lot of people don't realize is that before we get to the point of investment, when we go behind the process of the investment, Insight does a ton of diligence and research into the sector. What was it that really stood out about Clarify that highlighted that it was truly such a point of differentiation for the healthcare sector?
Yeah, thanks, Nikki. I too like the Moneyball analogy, Jean. And I think, that's apropos of what Jean was saying, which is that, it is a huge market opportunity. So if I think of the things that has attracted us to work with Clarify. One, we estimated that it's north of $15 billion just in payers and providers alone, the data and analytics business. But when you add life sciences, it's probably another $15 or $20 billion as well. It goes to this lack of there's this inefficiency in healthcare, just because of there's a lack of timely information available to the doctors and available to the payers when they think about that patient journey. So there is a perfect storm of industry trends that are happening right now, driving real demand for real insights in real time. Value-based care rather than fee-for-service is on the rise. And so people, if you think about that patient journey, you will need, or as a physician or as a payer, you need better information about that. So it's critical that what Jean's doing is taking away that siloed information to ensure that the full picture is known about the patient, but also about the provider and the hospital system. So that's the first thing. It's just a huge opportunity. Secondly is like what Jean and Todd have built is an actual software platform. So we invest in SaaS. So we don't want to be investing in services. We don't want to be investing in things that are once-off, bespoke for every customer. We want something that is available to millions of users where they can drill down and they can have the data at their fingertips. So it's a real software platform. It's repeatable. It brings the full patient picture together. It marries data from outside of the four walls of a hospital, so social determinants of health and things like that, with the hospital and the provider and the patient's own information. And it augments it with this very powerful machine learning algorithm. So it's software with this powerful algorithm that underpins it. That's a huge point of differentiation. The second thing is, the third thing is we talk to a lot of customers, as you know, Nikki, and John will know, we talked to all of his customers. They were very kind to give us their time. And, what they said really convinced us of the value. They talked very much about the better decisions that they were able to make, the way they had data at their fingertips, the quick ROI, the fact that ROI, even after 3 weeks or 4 weeks of implementation, they're able to reduce the burden on the healthcare system because they have fewer wasted dollars, they keep dollars within their network. They have better efficiency because it's reducing inpatient time, or able to adjust between poorly performing hospitals, poorly performing protocols for care. So there's just so many ways that the data helps them, and they were big advocates. They were huge advocates of the product, and so that's a big deal for us, that customers want to use the product and can think of other areas, other use cases where they'll use it over time. And then, the final thing is just management in the team. So, Jean, Todd, Manisha, Nadeem, Nishta, we met so many fantastic executives at Clarify, and all of them have this growth mindset. And that's another thing that we really care about, which is how are you nimble? How are you focused on growth? How do you think about the customers, but also how do you think about how to scale the organization? So, in scaling a company, it's not just about scaling the number of customers, but scaling the company and the organization as well. And they have that very, growth mindset with a big learning mindset as well, which is, whatever we can do to learn and improve, we will.
Yeah, which we love, because our team at Insight will definitely be rolling up our sleeves and helping scale and learn together. And so, Jean, you've been actually, just to kind of recap for people watching, Insight invests in SaaS, as Hilary mentioned, but also SaaS scale-up. So these are companies that, to Hilary's point, have customers that are using them, are really on the path to increase scale, are focused on operational excellence, and are really at a point where they are enterprise ready, customer ready, client ready. So Jean, you've been building Clarify for 6 years, and not only has the business grown and scaled, but the ecosystem and the industry in the healthcare space has also evolved. What have you seen over the last 6 years as you've been building Clarify, and why is Clarify now best placed as a provider and a solution for the healthcare sector?
So a couple of big trends were emerging in 2015 and have dramatically accelerated in the past few years. One of them is there is slowly starting to be payment model reform away from fee for service and towards rewarding for value, outcomes, et cetera. So there's a natural need for better business insight. The second is that cloud computing is now very much a real thing and finally coming into healthcare. There's an old saying that it takes 17 years for a good innovation that's proven to actually get scaled in healthcare. And it looks like we may go a little faster with cloud computing, faster analytics. The big one, though, is the availability of, it's odd to say this for healthcare, but of a large enough, clean enough data set. And there are companies out there like Datavant and HealthVerity that are making it possible to stitch together different data sets, electronic health record, lab, social determinants of health, in a far easier way than it was before. And very quickly, it's now possible to pull together these large data sets. Importantly, as a result of it, a lot of folks will tell you that they now have a map of healthcare so that we don't have to operate with a blindfold anymore. The question I would pose, though, to folks is, what kind of map are we talking about? Are we talking about the tick style, very manual, you go into the AAA and you're reading something on paper, or is it a map with a pinpoint GPS on it? And, clinicians really and patients difference very, very quickly. And I think the unique thing about the way we've built the stack at Clarify is it's incredibly scalable. Without a doubt, it has the most precise set of insights, so the most precise GPS on that map. And the third thing is the speed at which you get the insight. So it's funny, the analytics or insights generation model in healthcare is still pretty Neanderthal, which is people say, oh, what new data set do you have for me? It's not what insight, it's what data set. And I'll bring it into my dirty data lake. I'll send a few people off into a dark hole to SQL query for a few weeks, and then they'll come out with something that still looks like an Excel spreadsheet prettied up in Tableau. As opposed to what you have in other industries, which is, I have a need for an insight. Great, yeah, there's data here, there's an insight on the other side, and there's a factory or a refinery that on demand, self-service gives you the insight in seconds or milliseconds. And that's what Clarify has built for healthcare. Major difference from the alternatives that still rely on a secret army in the background doing manual SQL queries all hours of the day.
Incredibly critical. And I think for anyone who's listening in live to our Behind the Investment in Clarify Health, whether or not you're in the healthcare sector, you're going to recognize that detrimental challenge when you're dealing with imperfect or muddy data. And also when you are trying to get timely and rapid insights from the data. And that's clearly a solution that Clarify has built, which in a critically important sector. And so Hilary, Insight's actually been quite active in the healthcare sector. And I'd love to hear some of your insights into the space and why that focus on data analytics for healthcare it's a non-negotiable now. We need that in our healthcare system.
Yeah, Sean, I totally agree with everything you're saying. I mean, Insights, part of the reason we got excited about Clarify was because they bring decision-making to the frontline worker. It's not something that's done by the IT organization doing SQL queries in the background. It takes a week to deliver insights. It actually is in the hands of the decision maker. And so we've invested in a lot of other companies that are doing similar things in healthcare. We like to say we like to, invest in companies that are doing well by doing good in the world. And certainly, Clarify falls right in that sweet spot. But, some of the other companies that we've backed fall into 3 or 4 categories. There is care delivery, there is data and analytics, and then there's actually helping the institutions themselves be more efficient, kind of digital transformation. So if I think of the first one around care delivery, this is enabling therapeutic solutions enabled by digital technologies. So I'll give you a great example. Because of COVID, we've all been at home. And so telehealth has become, where it was something that was nascent. When John started, Clarify in 2015, there was the talk of telehealth, but it wasn't really, happening. And it still, in fact, has not been happening. And yet, what COVID did was allow doctors to do, and patients to adopt telehealth at a much more rapid pace. But in order to do that effectively, we've now invested in this company called TytoCare. TytoCare has the small handheld device. It allows the doctor to look down a patient's throat, to look in their ear, to measure their pulse, to listen to their heart. It's in fact a diagnostic tool all in one. So if you own one of those as a household, and you're on the phone with the doctor, you can have a complete diagnostic without needing to go into the doctor's office. Similarly, in terms of patient care and using data and analytics, Hinge Health, Force Therapeutics, both of these are organizations. Hinge Health, for example, where it gives patients nudges around how they can take care of themselves when they're post-surgery in musculoskeletal knees and hips and backs and things. A lot of the patient's journey is around them owning their own care and owning their recovery. And so these apps help them adhere to the regime that they need to adhere to. And, that's nudged by the physician, but it's also nudged by AI and ML, the big data that John's talking about, because we've seen what works with other patients over the years. And we've also seen what reminders work and when those reminders work. And if it's a Friday or a Monday, or when should you check in? And, all of those factors go into helping patients adhere. 2 more examples, but they both go to what John's talking about around data and analytics. Covera Health uses AI to read X-rays. So we're never going to get rid of the radiologist, but how do you take millions of data points of reading, breast cancer scans or lung cancer scans, and how do you interpret those scans? Well, if AI can do the 80, 97, 99% of it for you, and then provide that in faster time to the radiologist, using the kind of data that John's been talking about, the radiologist is able to make quicker and faster diagnoses, and then hopefully that data feeds into John's entire patient journey, so that ultimately, the people making decisions about care have all the data at their fingertips. So we've invested in Covera Health that does AI for x-rays, and most recently in a company called Theatre, and they do surgical decision support. So just while you're in the theater, how do you help the physician or the surgeon make decisions about how to manage that surgery? So lots of interesting areas to invest in healthcare. It's a big focus for us because of the mission-driven nature, but because it's an enormous market with it, as Jean mentioned, massive need for overhaul.
I'm going to ask one more question and then come back to the mission-driven, which I didn't realize we were so aligned there, but it's a personal passion of mine, so we're going to talk about that. But Jean, what we've just heard, Hilary just rattled off a couple of different portfolio companies, and healthcare is so complex and so large, and the needs for patients who are dealing with skeletal issues are very different from those who are cancer patients. And what is so exciting about Clarify is just how a focus on data and analytics can be so far-reaching across their healthcare ecosystem. Which does mean that you actually support a number of different personas or stakeholders or people and divisions within this healthcare space. Can you give me some more detail about the value Clarify brings to select your two favorite personas? I know it's going to be like picking your favorite children, but just to really bring to life how Clarify is creating such a difference in the healthcare ecosystem.
Sure. So ultimately, the greatest value of Clarify for any persona is to speed the time to a better decision, which ultimately leads to a better outcome. If I pick one, health insurers in this country, the way that they succeed is they bring in their members, and then with the money that they've brought in premiums every year, they want to deliver the best possible care, and at the end still end up with the margin they're entitled to from a regulatory point of view. One of their biggest levers is picking and choosing the right physicians. So the PCPs and the specialists in any market where they offer a plan, say Denver. And then once those physicians are on their team, they want to help them to deliver care as well as possible. Mm-hmm. Okay. So one thing that Clarify has cracked is to be able to literally on a map in real time show every PCP and specialist in any geography in the country. And this is where the Moneyball analytics or analogy comes in, which is we're able to provide a far more precise assessment of efficiency and quality of performance, and ultimately turn it into a score that can be trusted both by the payer and the clinicians they're contracting with. And so the time for a payer to develop a new network has been reduced from over 2 years to something more. Even for a Medicare Advantage plan that, for example, has 70,000 members, one extra year in the market is $100 million in bottom line profit. Wow. And then similarly, you can think of, okay, well, if you're able to now see who's practicing better and more efficiently, similar types of savings, we can identify 5 to 10% savings in the addressable variation, so the practice pattern that is on the ground, and give very specific insights that clinicians can then choose whether they want to deploy or not. We're not telling clinicians how they need to practice. It's the analogy of the map. The map is so much clearer that they are able to go on their own far more fulfilling learning journey, because the last thing clinicians want is for their autonomy to be taken away. That's a human need that all of us have as workers, employees, right? And so we've built this so that it delivers and the foundation to give people more autonomy. So ultimately, that's a non-trivial value. So I've taken you in this example from the administrator making the decision on which physicians go in down to the clinician who now has the autonomy to go on a much more fulfilling learning journey and improvement journey.
And that value proposition is so clear and rings true for so many different industries and CEOs in your position of, making sure that every stakeholder in a journey is able to see and gain value from data and insights. And that is just, it's just critical for improved efficiency and effectiveness. Thank you. That was extremely clear. And so you've both mentioned an alignment of culture and values. And for those who are listening into this behind the investment with Clarify Health, taking investment is a big deal, and selecting a partner, because we are going to be on a scale-up journey together. But I'd love, and feel free, either of you jump in, the culture piece and how critical it is to be aligned. What was it that really stood out, and what will you both be leaning on each other as you build the company from a culture and diversity perspective? Because you both mentioned
Hillary, I'm going to let you go first this time.
Okay, I got this one. So Nikki knows this, but Insight has several core values, and I'll name the first two. The first is hunger to win. And I think that, we have that at Insight, but I definitely saw that in Jean and Todd and team, which is, it's a hunger to win in the market, to be successful, to be competitive, to provide the value to customers. But our second value is, you couple that with heart, doing the right thing in the right way. And I think that's where this balance comes in. Jean talked about it, but we want to win, and we believe that Clarify Health is the winning software solution in this market for people who need to make healthcare decisions. But they're coupling that with the right attitude, the right heart. They want to do the best by their customers. There's a huge customer success team led by Manisha that really supports customers to make sure that they're getting the value from the product, that's training them and onboarding them. And then there's a huge team of software developers led by Todd who are building software that they really know customers want. So, for us, that was definitely an alignment of culture, is the desire to win, the desire to be the best, but also to do it in the right way.
Jean, tell us about the culture at Clarify. For anyone who's listening in and wants to get into a business, maybe there is a career page on your website, but tell us about the culture at Clarify.
Sure. Well, Hillary's done a great job of summarizing it, which is we are blessed to have a team of colleagues who are incredibly passionate about making a huge difference in healthcare. And it goes way back to the foundation story of the company. Todd and I were introduced by a mutual friend. And what struck me when we first met was Todd saying, hey, my team and I, and there were literally 8 or 9 folks that came together as a package deal from the financial services industry. And the sentiment they all expressed, and it's still deeply, deeply held, was, hey, we spent 20 years building the leading cloud-based platforms that help rich people get richer. Now, also pension funds take good care of the money that pensioners are investing. But really love to do now is take a swing at making a big impact, or bringing the potential impact of those technologies into either healthcare or education. I happen to be lucky enough to be the first one, to meet Todd. I suspect if someone had come with a great education idea, that, you'd be hearing about clarifying education. But, so from the get-go, there was a sense that this was going to be something where we had to have the patient and those that we care for at the center of what we do. And there was just an attitude that this is so important that we're going to make sure that we get there. And so it aligns very, very well with the core values that Insight has and clearly lives by.
And Nikki, I wanted to say one thing, is that one of the things that, Jean and I didn't spend a lot of time talking about because it was just so obvious, but in other circumstances, sometimes we do spend time talking about it, is diversity, which is, Todd has an extremely diverse, Jean and Todd have an extremely diverse leadership team of people from all walks of life, different backgrounds, different ethnicities, different genders. And the reason that we like to invest behind companies that have that diversity as part of their ethos is because diversity of thought means that it's more robust. It just means that different perspectives are brought to the table and that different people are given opportunities. And, when you think about healthcare, we are serving an entire population. I mean, it is everybody, and there are some people historically who are disadvantaged in healthcare. And the one thing we want to make sure is that the software that Clarify provides for decision making advantages everybody in the same way and brings the right set of patient outcomes and better outcomes for everybody. So the fact that the team was already diverse to us was a huge plus.
Absolutely. That's wonderful. And Steve has mentioned in the comments that Clarify are growing. So anyone who has listened in or hopefully you do watch this as you're assessing whether you'd want to apply at Clarify and clearly see it is a company that is doing great by doing well. But we did have a couple questions as well, which fit into perfectly what I wanted to ask next. So one, Aaron has asked a question, and what many people don't realize, and this is for you, Hilary, is that Insight, I mentioned it earlier, really does roll up its sleeves and get involved and support our portfolio companies when they need us and how they need us. So what are some of the largest opportunities that the Insight team feels are unique to Clarify as opposed to other companies in the healthcare analytics space? And how are we going to be supporting them as they tackle and take advantage of these opportunities, but also maybe navigate some challenges in their scale-up journey as well?
Sure. So I think Jean was alluding to it, but Clarify can serve the life sciences industry, the providers and physicians industry, as well as the insurers, the payers. And there are different ways in which they would all use or make use of very similar data. And so one of the advantages that we think Clarify has is that each of the stakeholders will find value in the solution, because the data and the analytics engine that's being created can service multiple companies and can scale to very different use cases and different users. So for example, in life sciences, as you're thinking about, and we're all so familiar with life sciences these days, we all know more about vaccines than we thought we'd ever know. But we also know more about, because we put ourselves in the shoes. And, today, as you're thinking about vaccine trials, for example, any trial, who are the right patients? How do you identify the right patients to be part of a clinical trial? Clarify can help identify those patients. In the insurer side, which are the physicians that are producing better quality of care, and what does that look like? Clarify can help there. On the payer side, how do I build a network that gives that meets the healthcare needs of everybody in a single geographic area? Clarify can help there. How do I think about utilization management? So there are just so many use cases for Clarify that we think it truly differentiates them in the market. And for us, what we're part of what we think our capital is going towards this year is just doubling down on what they have been doing. So doing more of it, but doing it at scale. So getting the go-to-market motion right. We've got a lot of customers already. So now it's like, how do we double those customers? How do we triple those customers? And how do we make them use the product in more and different ways? Jean, I don't know, what's your priorities for this year?
Yeah, I would say this year. So interestingly, in order to prove to folks that it was possible to have an enterprise analytics platform that could successfully scale across providers, payers, life sciences, we had to be unconventional and put out 5 business applications into the market as opposed to 1 or 2 and really focusing deep on those, which is the typical playbook. Now that we have terrific initial customers for all of those business applications, this year is really about executing against scaling those applications into the markets that they're in. Now, if you look beyond a year, and the examples Hilary gave really show the way. Healthcare, the 3 big sectors, life sciences, payer, and provider, they are converging. And interestingly, they're converging around a need for insights on a much richer understanding of patient journeys. And we feel that there's going to be for an objective third-party single source of the truth on the patient journey platform that sits between providers, payers, life science companies, and is able to provide the trust to really enable the shift from fee-for-service to fee-for-value. So if I use the payer and provider example, clinicians will say, sure, I'll accept a different payment model, but I need two things. I first need to know that the way you assess my performance to determine whether I get a bonus or a penalty is fair and reliably fair. And before I sign up to something new, I would need you to show me, if I just practice in the way that I'm practicing today on your fancy new payment model, am I going to be the same, worse, or better off? And they're not going to trust the person proposing the contract to be an objective provider of that perspective. Now, to be able to provide that perspective, you have to have the very precise GPS that says, hey, I can look at and benchmark this performance Moneyball style so that it adjusts for the reality that you're actually seeing on the ground day in, day out. Clarify is ideally positioned to be that objective single source of the truth, third party that builds the trust that is fundamental to these new payment models. By the way, as an aside, if we can get to that world, then all of the revenue cycle armies that we have fighting each other today basically go away. So that's the kind of promise beyond, the next year or two, is that this can actually be what enables the shift in the way we incentivize healthcare that policymakers have been trying to nudge us towards for the last 10 or 15 years.
Wow. I mean, you have a strong vision and one that will be extremely impactful. And I will ask, I'm not sure if you can see the questions because we did have a couple. There's clearly a lot of people that are very interested in all the different ways that Clarify can help, which is wonderful. And so Momo has asked specifically about how does comprehensive medication management fit in? And then Adi also asked about the fact that, to Hillary's point, clinical trials, I know more about clinical trials and vaccines than I ever thought I would know. And they've clearly become such a big part of the healthcare system. Will Clarify Health expand analytics to support that growing sector? So I guess if you can answer to specifics, or if you can highlight what areas you might also grow into.
Sure. So I'll take the comprehensive med management one first. Typically, those offerings from startup companies have been focused on the area that Hillary termed care delivery model innovation with digital engagement. Where we tend to play there is, and in fact, we've been having discussions with some very interesting companies that really are innovating on the last mile of care delivery. Their challenge is to be able to go to a payer and to say, hey, you should really use my service for a particular population because for that population, there's a big ROI. Well, so a payer, let's say, brings in 100,000 new members in a year. How do they know which 3,000 members are really going to get the ROI from an innovative, comprehensive med management solution? We are able to do the analytics to say, in all likelihood, this is the cohort that would best benefit from that type of service or care delivery model innovation. So that's where Clarify would play. And that's our Clarify Populations business application. For clinical trials, it is an area that we are very excited about. It's an area where we deliberately said, okay, while we have the analytics to really help there, we have to learn to crawl before we walk, before we run. So our first foray into life sciences, we ended up helping the brand teams to identify the physicians and the patient cohorts that would best benefit from their existing or about to launch therapies. And that's where we're going to be focused for the next year. That said, it would not at all surprise me that you would see Clarify come out with something called Clarify Trials in the next couple of years.
The branded marketing team is rapidly going to work on Clarify Trials. No, thank you for that, Jean. And I'm gonna wrap us up with another rapid fire. For those who've been listening in to Behind the Investment with Jean, who's the CEO of Clarify Health, and Hilary Gosham, one of our managing directors at Insight. This has been such an insightful session on the healthcare sector and how data and analytics is absolutely critical. What I've heard is that you and the team have a lot to do, and it's a really exciting growth opportunity for Clarify Health, and we're thrilled to be your partner in it. So rapid fire question. Hilary, as a board member, and then Jean as the CEO, what are the growth levers that you are going to be focused on pulling over the next 12 months for Clarify Health? Hilary, I'll start with you.
Double down on the sales team. Give them the resources that they need in order to get in front of more customers, because I truly believe if they get in front of more customers, we'll sell more product. It's just not that many people know about it or have seen it yet.
I think our sales center of excellence are already rubbing their hands with glee to be able to support as you scale up your sales team. All right, Jean, what's growth lever is top of your mind?
Well, what goes with that is focus. Because if we can take what we have now and really train up our sales and solutions colleagues to be as persuasive as possible to potential customers and introduce them to the power of something that in many cases, totally understandably, they haven't known to ask for. Because the analogy I use sometimes is there's either the Henry Ford one when he said, hey, you need a car. People said, what do you mean? I just need a faster horse-drawn carriage, right? Or when Steve Jobs came out when we all had our BlackBerries and said, you need a smartphone. And we said, well, what are you talking about? Like, I like my keyboard and my BlackBerry. It's a little bit the same here. And so invest in executing on sales and then just really focus on what we've got now and don't get ourselves caught up, over our skis too much. And I can see us in a very exciting and measured way continuing to have and scaling impact through accelerated time to ROI, because that's ultimately the business value that we deliver. And it goes back to the values, right? Which is we're helping our customers to have a better chance at winning, and winning for them is improving patient care.
Absolutely.
So we get back in the end to doing well by doing good.
Absolutely. Well, that I think if you can get this message that everyone has listened to today about the incredible work that Clarify Health is doing to help the healthcare sector, it is blue skies ahead. And I know I speak on behalf of Hilary and the rest of Insight that we're thrilled to be on this scale up journey with you. So Jean, Hilary, thank you so much for joining Behind the Investment. To everyone who listened in live, it was Behind the Investment with Clarify Health. Thank you.
Thank you so much. Bye.
Cheers.